At 11, in just a matter of hours, nurses at Windham Hospital will be going on strike. Tonight, they're making last-minute preparations before they walk off the job. Channel 3 Eyewitness News reporter Patricia Del Rio is joining us live right now from right outside the hospital with more on what will be happening there tomorrow morning. Patricia?
Mark, the nurses say that they are going to go on strike at 7 a.m. tomorrow. This is going to be a 48-hour strike. Now, these negotiations have been going on for months, but the nurses union says that the hospital is not meeting their demands. They say that they're not even going halfway on their demands, but the hospital says that the demands of the nurses union is outside the economics of their offer.
In June, the hospital had issued a proposal and had stated that this is it, there's no other negotiation, and that should we not ratify this, they would take any retroactive monies owed to the nurses off the table.
The president of the Windham Nurses Federation says Hartford Healthcare's lack of movement in negotiations has forced them into having to strike. Tonight, the picket signs are being drawn up and are ready to go for tomorrow morning's strike. Nurses say their biggest concern has been forced mandatory overtime.
Mandatory overtime is when the hospital comes to a nurse at the end of her shift, mandating her to stay longer to work. It's a total of 16 hours. It leads to, it's burnout, increased fatigue, medical error, which results in patient death, which is, of course, the last thing a nurse would ever want to do.
Another demand from nurses is a wage increase. They haven't had one in over 2 years.
But we also need a wage increase that is commensurate to the cost of living, and that's what we've been fighting for, and the hospital is just not meeting us there.
Nurses also demanding affordable health insurance.
The nurses cannot afford to go to the doctors. They cannot afford their medication. They're determining, can I go to this, to the emergency room if I'm having chest pain? Can I afford my prescription? Or do I have to put food on the table for my child? No nurse should have to do that.
Hartford Healthcare says it has offered elimination of mandatory overtime, wage increases, and expanded salary ranges, as well as health insurance premium contributions. The nurses union says that Hartford Healthcare's offer is well short of what is needed. Meantime, the hospital does say that they will have adequate staffing tomorrow when the strike begins, and they assure that patients will still be well taken care of. We're live in Willimantic. I'm Patricia Del Rio on Channel 3 Eyewitness News.